Example of Canada's emergency care crisis. Paramedics in Toronto responded to an emergency call just a few blocks from a hospital, only to be told to take the patient somewhere else. Tom Popick reports.
It's still a surprise.
3475.
Rookie paramedics Pascal Hines and Paul Tarsitano were hired last spring to solve Ontario's emergency service crisis. But now with a patient in distress and help just blocks away,
Right beside the Toronto Western, we're hoping
they're being turned to another hospital across this busy city.
We can't make it in unless it's a priority 4.
Another redirect, plugging holes in the healthcare system ready to burst.
Well, think of the emergency room as a barometer for the rest of the healthcare system.
And the Toronto Hospital Association says the storm won't let up. Toronto needs 400 more beds to solve its chronic emergency room backlog. Efficient hospitals work at 85% capacity without compromising patient care, but they're now working
in the mid-90s.
It means patients are stacked in hallways, hospitals short-staffed, and professionals overworked. In Toronto, Vancouver, and cities across Canada, emergency beds are being taken up by patients who should be moving to long-term and acute care wards. Inpatient beds that were cut just years ago.
If money will solve it, we will, and there's a meeting today to deal with the emergency room situation.
Ontario's health ministry, hospitals, and ambulance services are now working on a plan to keep at least 3 district emergency rooms open at all times.
Our patient's just being upgraded to 4.
This worsening patient got the quick treatment she needed, but paramedics say a patient might as well walk for help.
They don't have a bed in the room, so right now the patient's lying on a stretcher.
The health system is still waiting for fixes promised a year ago.